Schools play a major role in improving the health status of Australian youth, and today we'll be looking at the major health issues that impact on the health of Australian youth, such as patterns, causes and effects, how physical activity and sport have the potential to help Australian youth achieve better health outcomes, and the role that schools can play in improving the health status of Australian youth. According to the Australian Institute of Health and Welfare, there are 9 diseases and conditions known as the 9 National Health Priority Areas that Australian governments have chosen for focused attention because they contribute significantly to the burden of illness and injury in the Australian community. These are cancer, cardiovascular disease, injury, diabetes, arthritis, dementia, mental health, obesity, and asthma. The main national health priority areas for Australian youth, due to its commonness and high risk, are injury, diabetes, mental health, cancer, obesity, and asthma. These health issues have been identified as a priority due to the particular factors the government has considered. These are the social justice principles, priority population groups, prevalence of the condition, potential for prevention and early intervention, and costs to the individual and community. An injury is the physical damage that results when a human body is suddenly or briefly subjected to intolerable levels of energy. There are 2 types of injuries, intentional and unintentional. Injury is an extremely relevant health priority as the 2 main groups at risk of injury are young children and males aged between 15 to 24 years old. Injury accounts for approximately 44% of all hospitalizations. With this in mind, it is shown that this health issue is the most important in terms of Australian youth. The reasons for youth injury is a result from a mixture of parental neglect, a child's ability in assessing risk-taking, and their courage to take on that risk, and also mental health issues. If a person is above 30 on their body mass index, they are usually considered to be overweight. In 2013, 25% of Australian youth were overweight and 10% were obese, and this statistic is increasing. Obesity is a serious health issue among Australian youth as they usually coexist or bring up mental health issues such as self-harm, depression, substance abuse, and obsessive-compulsive disorders. Obesity is less of a parental neglect and more of a parental uneducation or household culture. Promotion of how to eat healthier or nutritiously and exercise within the household would be an ideal way to lower this increasing health issue. Asthma is a condition characterized by breathing difficulty where there is a reduction in the width of the airways leading to the lungs, resulting in less air being available to them. Approximately 1 in 4 children between 0 to 14 years old have been diagnosed with asthma, but for people aged 15 and over, this rate fell 39% to about 11 in 100 kids. Due to a wide range of reasons of being able to get asthma, it means that it would be more beneficial to look into treatment instead of prevention for asthma. Death rates for young males is higher than females. This is probably due to behavior causes such as higher risk-taking. However, there is a slight but consistent decline in mortality rates as of the past decade. The major causes of death are accidents, poisoning, cancer, and suicide. This shows that young people are more likely to die as a result of a preventable cause of death. The leading cause of morbidity in young people is mental disorders, injury, and poisoning, which is the very opposite to the rest of the population, which their leading causes are circulatory diseases and cancer. The overall morbidity rate is slowly declining, with asthma and hospitalizations declining. The effects of the young person's health can be divided into 4 factors. These are an individual or personal effect, socio-cultural, socio-economical or financial, and environmental. Physical activity and sport has the potential to help Australian youth achieve better outcomes. In 1997, a group of American scientists spent 2 years testing the effects of physical activity in school, and it was proven that a health-related physical education curriculum can provide students with substantially more physical activity during physical educational classes. Improved physical education classes can potentially benefit 97% of primary school students. Another group of scientists proved that providing game equipment during break time dramatically increased their physical activity, therefore drastically improving the youth's health. It was also proven to positively affect the youth's cardiovascular system. It is recommended by the World Health Organization for children to engage in physical activity as well. Their guidelines include that the children and youth aged 5 to 17 should accumulate at least 60 minutes of moderate to vigorous intensity physical activity daily, and amounts of physical activity greater than 60 minutes provide additional health benefits. Most of the daily physical activity should be aerobic. Vigorous intensity activities should be incorporated, including those that strengthen muscle and bone at least 3 times per week. The positive values, physical activity, social connection, and communication dimensions of sport, and their careful application in well-designed programs hold enormous potential to help achieve health goals for the Australian youth. However, sport alone cannot prevent or treat disease. Instead, sport is a highly effective tool in a broader kit of development practices. Only when it is applied in a holistic and integrated manner can sport achieve development results. Schools can play a major role in improving the health status of Australian youth. For example, as stated before, it's been proved that moderate to intense physical activity can potentially benefit 97% of primary school students, and it can also dramatically increase their physical activity, therefore drastically improving the youth's health. There are 2 key purposes of health promoting schools: to enhance educational outcomes and to facilitate action for health by building health knowledge and skills in the cognitive, social, and behavioural domains. One way that the schools can influence the impact they have on the Australian youth on improving their health status is by using health promotion. This can be put into action by using the 5 action areas of the Ottawa Charter. These are: developing personal skills. This is aimed to improve the knowledge and skills of individuals so they can make informed health decisions for themselves. An example for this would be hiring Healthy Harold to come visit the school to teach them about and making them aware of the dangers of drugs. Creating supportive environments. This is creating an environment that increases the chances of a person being able to make positive changes to their health. An example of this in a school would be providing game equipment during break time to give the children more opportunities to get physically active. Strengthening community actions. This is showing the development of health promotion strategies intended to improve health with a strong sense of diversity. An example of this being used in a school would be getting parents involved, sending home ideas for nutrition meals, and wearing appropriate clothing. Reorientating health services. This encourages the health sector to move beyond its traditional role of providing curative services. An example of this in a school would be the hiring the RFS to come into the school to give a talk about fires and how to reduce the hazard. Building healthy public policy. This is legislation, policies, and fiscal measures that create equity among individuals and across different populations. An example of this in a school would be the No Hat, No Play policy, which promotes a supportive environment for the children. Other examples of how schools can play a role in the children's health status include Walk Safely to School Day, Crunch and Sip, Jump Rope for Heart, and Bike for School Day. In conclusion, we have seen what the major health issues are for the Australian youth and the impact that these issues have and why they are so common. To help manage and prevent these major health issues, it's been shown that physical activity and sport have the potential to help Australian youth achieve better health outcomes, and what the role of schools can be to help reduce these health issues for Australian youth.